All right, thank you everybody for coming this afternoon. I'm Lindsay Crum. I'm the Assistant Dean for Advancement with the Colorado School of Public Health, and this lecture is through our Department of Environmental Occupational Health, and I'm pleased to introduce you to Linda Marsa. She is a journalist with a background in health and science writing. She worked at the LA Times and recently published the book Fevered, and so she is sharing the message of her research and concern about the issues facing our communities locally and around the world. So we're one of the schools that she has decided to visit. So we're really pleased to welcome her, and there'll be time for you to ask questions after her formal presentation. So thank you.
I'm having all kinds of trouble with this. Thank you. Anyway, thank you for having me. It's good to meet you all, and thank you for taking the time for coming. I got interested in writing about this. I'm mainly a medical writer, and I sort of now have moved into the environmental area. Can everybody hear me, by the way? Am I talking loud enough? I kind of have a loud voice. I got interested in the writing about this topic probably about 4 or 5 years ago. You know, like everybody, I'm a human being. I've been reading about climate change, how it's going to impact us. But I thought, you know, there's a lot of really wonderful environmental journalists out there. You know, what could I add? But there was 2 things that happened. There was a report by the Natural Resources Defense Council that talked about the spread of vector-borne diseases to newly warming habitats, and this came out in 2009. And then right on the heels of that, a huge report came out in The Lancet, which some of you may be familiar with, that talked about how climate change is the greatest public health threat of the 21st century. And when I saw that, I thought, wow, I mean, that's really incredible. And that caused me to dig in. And the book itself is really focused on the United States and places like Australia and Europe, but obviously climate change is going to be hitting the developing nations much more keenly than it's going to be hitting in the industrialized nations, simply because people don't have the infrastructure to protect against some of the devastation of climate change. You know, when I first started writing the book, one of the books I read for background was Thomas Friedman's Hot, Flat, and Crowded. And one of the things he talked about is that there's this huge gap in the scientific community between what the scientific community knows and what the general public knows. And I felt that a lot when I was writing the book, that I would talk to the scientists, their hair was on fire, and then I'd sort of come up for air in the real world, and everybody's watering the lawn and, you know, mowing the lawn and stuff like that. But the thing that he did say is that at a certain point, it will become blindingly obvious. And I think we're at blindingly obvious now. This is, you know, from January to last year, 2012, difference from average temperature. You can see the United States is very hot, Russia. You know, I saw pictures this year of sunbathers in Siberia. That's going to be the next title of my next book. You know, we used to think that climate change is, you know, these poor starving polar bears, but this is really what climate change looks like. You know, obviously, every single extreme weather event you cannot attribute to climate change. You know, you have to get a study in, you've got to parse all that stuff out, so you can't. But what we do know is that what climate change looks like is weather on steroids. I'm sure you've heard that metaphor. So what that means is that wet places get wetter, dry places get drier. You get the drift. As storms get fiercer, more frequent, more intense. So this is what climate change looks like. You know, you have the Colorado floods, you have more fires, you know, and some of this stuff you really don't need a study. Some of this stuff is, you know, really sort of basic common sense. It gets hotter and drier. You know, you have more kindling, you've got worse fires. And, you know, there's a lot of debate about how, you know, this caused this fire, if that caused that fire within the scientific community. But I talk to firefighters, and, you know, they're on the front lines, and they tell me the fires are different. They're much fiercer, they're much more intense, they're much harder to control. They spread over many more areas. The other thing about fires in terms of health is that it spews all this, you know, CO2 and black soot into the atmosphere, and it creates these pulses of CO2 that equal often the emissions of a small city for a year. So, you know, it creates this feedback loop where it creates even worse climate change. And then here, this is really pretty terrible, how much it destroyed of Yosemite. And then you get the spillover effect in that, you know, the changing climate causes other things to happen. You know, it threatened the water supply in San Francisco. Again, Hurricane Sandy. This debate as to whether the hurricane itself was caused by climate change. You know, the scientists are still arguing about that. But one of the things that we do know for sure is that the storm surge that, you know, swamped New Jersey and also lower Manhattan, these pictures take my breath away. For those of you who've ever spent any time in Manhattan, I have friends that live in lower Manhattan, and it was completely without power for over a week. They had to move uptown. But, you know, again, you know, the poor, the disenfranchised, you know, people of color, they didn't have places to move uptown. You know, you had stories of visiting nurses finding people nearly in diabetic comas that are stranded on the 12th floor of high-rises. So this is the devastation from Hurricane Sandy. This is actually an apartment complex where a friend of mine lives on the, in the East Village. This you can see, again, Hurricane Katrina. I'm sorry, I put that, I know, that's really. These pictures were taken by one of the people that I interviewed for the book. This is Billy Shanks. He's a fire department captain with the New Orleans Fire Department, and this woman is carrying a 6-week-old baby. And this story always flabbergasts me. Billy asked her, he said, "Why didn't you evacuate?" And she said, "I didn't think it was going to be that bad." And that's where we are with climate change, is we don't really understand how bad it's going to get. But this is, you know, projections for 2050, the climate change impacts on water. We'll have extreme water in the, you know, in the southwestern areas. I'm from Los Angeles. This is pretty ominous right here, you know, in Florida. If Florida is still above water by 2050, because as you well know, with sea level rise, we all saw the IPCC report, which talks about sea level rise of 3 feet. Miami is the most vulnerable city on the planet to climate change. All right, again, Colorado River is drying up. We could see sea level rises here. So here's why you're here to listen to me, is to talk about the health effects. You know, this is all kind of the background of what's happening. You know, you have the weather on steroids, you know, creating more extreme weather events. At the same time, it's just getting warmer. You know, it's been 2 degrees warmer since the Industrial Revolution. We're expecting it to warm up at least another 2 degrees between now and the end of this century, which may not seem like a lot. But, you know, again, when I was thinking about writing the book, I stumbled across a study, and it was a study that made me write the book. I came across a study that was done by Siegfried Schubert, and he should pay me money because I've been giving him so much free publicity. And he had looked at the surface temperatures of the ocean over the past 100 years. And what he found, and this one stopped me cold, what he found is that the surface temperature of the ocean had changed by 1 degree. 1 degree, and it caused the drought that caused the Dust Bowl. Because what happened was the jet stream that normally dumps water over the Midwest was redirected because of the change in the surface temperatures. Now, obviously, you know, this is complicated. You have to unpack it. They were farming on places where they shouldn't be farming. They had poor soil conservation techniques, you know, and on and on and on. But as long as it rained, it washed away their sins. So this really sort of illuminates climate change as a driver. It was the match that lit the kindling. So here in the United States, my assistant did that. She said, "We got to make it a little jazzy. You're so boring, Linda," you know. But anyway, this is the kind of stuff that we're looking at in the United States. And I think the primary thing that we're looking at here is more natural disasters that will strain the healthcare system beyond its limits. We saw what happened in New Orleans. You know, there were 16 area hospitals. Only 3 were able to reopen right after the storm. You had 13 that were closed for varying lengths of time. And the 2 public health hospitals, including Charity Hospital, which is, it's always a contest between them and Bellevue, which is the oldest hospital in the United States, remains closed to this day. They had only 1 level 1 trauma center that was operational after the storm, which meant that if you had a gunshot wound, you had to be airlifted 350 miles to Shreveport. You're public health guys, you know what that means. Time is brain. You know, time is heart, time is whatever. You know, so there were people dying unnecessarily because of the poor public health system. You know, I could go on and on about what happened in New Orleans, but this sort of gives you a picture. And it would be nice to think that we learned all the lessons from New Orleans. We learned some, but, you know, in Superstorm Sandy, we saw many of the same things that happened. You didn't see a complete demolishment of the public health system, but we saw some of the same problems. For starters, just a little tip. If you're going to put a generator in a floodplain in the basement, you need to have your head examined. And, you know, at NYU and at Bellevue, they had the generators in the basement. Hello? You know, and we had that same spectacle of people having to be evacuated, very, very ill people with all this kind of apparatus, you know, down, you know, 12 flights of darkened stairwells and having to be evacuated in the middle of the storm. And, you know, I kind of make jokes because this is very serious stuff and I'm trying to keep a little levity in here without all the doom and gloom. But, you know, we've learned some of the lessons, but not all of them. You know, and I always look at these little factoids that sort of illuminate, you know, what's going on. And, you know, in the Far Rockaways, again, you know, people of color, the poor, the disenfranchised, the people that were living in public housing, they were stranded on the 12th floor, not able to get their medications. You know, the medical records were lost. You know, the little factoid that I sort of flashed on is Doctors Without Borders, for the very first time in its storied history, set up a clinic on American soil in Far Rockaway. So that's how great the need was. All right, increasingly bad air will trigger rising rates of asthma, allergies, heart and lung diseases, even dementia. Let me sort of tackle the dementia stuff first. I saw a couple studies on this, so that's just, I'm kind of throwing that out there, that, you know, breathing in all that, you know, particulate, that small PM 2.5 can cause dementia. Like I said, I just saw a couple studies on that, so I'm not taking that one to the bank, but I throw that in there. But, you know, obviously heart disease, we know that breathing in all this bad air causes plaque to form on the arteries, and obviously lung disease. Allergies, obviously the allergy season is starting earlier and it's lasting later. The other piece of this is one of my favorite little stories in the book. What we're having develop now is what I call hoodlum weeds. You know, you have this CO2 enriched air now, and CO2 is obviously food for plants. And this plant physiologist, Louis Ziska at the USDA, did these experiments, and he planted some weeds in downtown Baltimore, which had kind of the air quality, the ambient, you know, 500, 600 carbon parts per million that we'll be seeing in the future. Then he planted weeds in the suburbs, and then he planted weeds in an organic farm. And he found the downtown weeds, as I call them, grew twice the size of the weeds on the organic farm, plus the allergens that the weeds produce were something like 100 times more noxious. So this is the kind of stuff that we're looking at. Obviously, you know, we're dumping 32, I can't even fathom this, we're dumping 32 gigatons of CO2 into the atmosphere every year. Now, a gigaton is 1 billion tons, which means that is equivalent to about twice the weight of every person on planet Earth. You know, I try and quantify this stuff in some kind of real terms. So we're dumping 60 times the weight of every person on this Earth into the atmosphere every year. And as I always say to my husband, what could go wrong? But the point is that we're having all this carbon collect in the atmosphere, and in places it's starting to, over cities where you have the, you know, urban heat island effect, it's starting to collect in carbon domes over cities. We're seeing this in places like the Central Valley in California. We're seeing this in Salt Lake City. And obviously we're seeing it all over China and Beijing and Shanghai and places like that. And, you know, they've done studies that, you know, the cumulative effect of being exposed to this air, especially in children, and you guys as public health people are on the front lines of this, you know, 20% reduction in lung development. And, you know, it's not like, you know, the kids get into a better atmosphere and then they can catch up. I mean, there's a developmental window that closes and they're impaired for life. And I know in California Central Valley, 1 out of every 4 kids has allergies. You know, I've talked to respiratory therapists there, and they talk about, you know, every single, you know, room that I have in the clinic is filled with kids that are on steroids and bronchodilators and things like that. So this is the kind of thing that we're going to see more and more of. Another thing that we're going to see is insects migrating to newly warm habitats and changing ecosystems, which will cause outbreaks of West Nile, dengue fever, hantavirus pulmonary syndrome, valley fever, and exotic diseases we've never even seen before that I can barely pronounce. But basically what's happening is that as the weather gets warmer, you know, the mosquitoes and other vectors, such as, you know, the ticks that carry Lyme disease, are migrating northward, and they're living in these newly warming habitats. We have Lyme disease now in Canada, and Lyme disease possibly, you know, I couch this in, you know, very equivocal terms because the ticks can't tell us, you know, where they started, but, you know, we sort of trace them down, and it was first identified in Lyme, Connecticut, and, you know, now it's endemic now in Canada. West Nile. West Nile is a prime example. West Nile virus, as the name implies, was first discovered in the late 1930s in the West Nile district in Uganda. And, you know, West Nile was pretty much limited to northern Africa, Israel. We would have fungal outbreaks. We had some outbreaks in Romania. But it stayed there. It didn't really spread very far because the disease vectors, the mosquitoes that carried West Nile, really couldn't thrive here. But in 1999, we had a West Nile outbreak in New York City, and it had the kind of weather patterns that summer that we're going to be seeing more and more of with climate change. You had very, very hot summers, you know, 90 plus temperatures, plus torrential rains. So the mosquito populations just exploded. The way the public health officials tracked it, they believe that somebody from Israel, where they were having an outbreak, came to visit some relative in Whitestone, mosquito bit him, and then it spread. Now, normally, the spread would be stopped right there, sort of in its tracks. But because there was such a large mosquito population, it spread, and it was able to become endemic. And then in 2002, when we had the same kind of weather patterns, very, very hot summer, torrential rains, it's exploded across the country. Dengue fever we eradicated decades ago, you know, with carpet bombing with DDT. Dengue fever now is endemic in Florida. It's endemic in Puerto Rico. We've had outbreaks in Texas, and it's starting to spread northward. Hantavirus pulmonary syndrome. This is another sort of interesting thing that has to do with changing ecosystems. What happens with hantavirus pulmonary syndrome, and the first outbreak was in the Four Corners on Native American land, is that the hantavirus, which causes this pulmonary syndrome, remains dormant. But what happened was there was weather patterns that we'll be seeing more of, like in climate change, with very, very long drought, and then suddenly you have these torrential rains, which exploded the, you know, growth of vegetation, that the deer mice that spread this virus, suddenly those populations exploded, and suddenly you see these outbreaks. And we had an outbreak of hantavirus pulmonary syndrome last summer in Yosemite. 2 people died. The mortality rate for hantavirus pulmonary syndrome is 30%. And not only did 2 people die, but thousands of people were exposed all over the world. Valley fever. Valley fever is endemic to California's Central Valley and also to Arizona. It's a fungal disease. It's carried in fungal spores. Again, you know, the kind of weather patterns that we're seeing with climate change as the environmental belt that's hospitable to the valley fever source. And it's this coca maga, I can't pronounce it, another one I can't pronounce, but it's because the environmental belt that is hospitable to valley fever is now spreading. The CDC calls it a silent epidemic. They believe that up to 200,000 people are infected every year. The mortality rates are higher than that for Lyme disease, West Nile, Salmonella. And this is sort of a, you know, hidden disease. The other piece of all of this is West Nile, dengue, hantavirus, valley fever. We have no treatments, and we have no vaccines. All right, higher temperatures mean spikes in heat wave-related deaths. You know, we saw that happened in Chicago. I don't know if some of you are familiar with this. In 1995, there was a terrible heat wave in Chicago. The public officials really had no idea what they were dealing with. And ultimately, almost 800 people died, and another 3,500 were debilitated. And a third of those people within a year died from the illness, you know, the neurological deficits and the heart deficits that occurred because of heat stroke. The European heat wave, you know, I devoted a large chapter, a large chunk of one chapter in the book on the European heat wave. One of the people that I interviewed for the book was George Luber, who is at the Center for Disease Control. Some of you may know him. He's really just a great guy. He's an expert in heat. And, you know, as a young epidemiologist, which some of you may be very soon, he was dispatched to Paris in the middle of the heat wave, you know, and sort of parachuted in. And, you know, here again, they had no idea what they were dealing with. They didn't realize that, you know, people could die from the heat. And it was sort of this perfect storm of, you know, bad luck. It happened in August. Everybody was away. Everybody parked their elderly relatives in rest homes. Public health officials were away. And because they were really ignorant of the enormity and the consequences of what was going on, they, you know, weren't coming back. They didn't cut short their vacations. You know, ultimately, you know, after this all happened, you know, heads rolled and people lost their jobs. But in the meantime, the estimates range from 35,000 to 70,000 people died in the European heat wave. And it was particularly significant in France, where 15,000 people died. And, you know, I won't give you all the ghastly stories of, you know, what people found and the morgues being, you know, overwhelmed and things like that. But, you know, when they look back, the heat was hotter in Europe, in Northern Europe, than it had ever been since Henry VIII was on the throne. And why that's an important factoid is because the Hadley Center in Great Britain, which is the Great Climate Change Modeling Center, now projects that by 2040, half the summers in Europe will be as hot as this one. All right, in Russia in 2010, now here you had the double whammy, which we're getting now, which is not only heat, but fires, you know, because you know, it's hot, you know, it creates all this kindling. And you had all these peat bogs spontaneously combusting outside of Russia. And, you know, for the book and also for stories I wrote, I interviewed a lot of expatriates that were living in Moscow. So I kind of covered this in real time. And, you know, they don't have really much air conditioning. And the interesting thing on all of this, and here again, you know, the Russian officials had no idea what they were dealing with. They didn't have extra ambulances. They didn't have any cooling centers open, on and on and on and on. And the upshot was 52,000 people died during the Russian heat wave. The only good thing about this was that it did force the Russian leadership to finally admit that climate change does exist. Okay, valley fever. Okay. This is, I don't know if any of you recognize this little fellow. I've written quite a lot about him. This is the Aedes albopictus mosquito, or better known as the Asian tiger mosquito. And this is just one example of what I'm talking about. There was a study that just came out about 4 or 5 months ago, and I did a blog post for the PLOS on this. The Aedes albopictus mosquito, some of you may know, arrived here, they believe, in tires that were imported from, I believe, Japan's or maybe somewhere in Southeast Asia, into Houston. So the Aedes albopictus lives in containers. The people, a PLOS study found that the Aedes albopictus mosquito is now endemic in Connecticut. So you can see how far it's migrated. You know, you have the milder winters so that the eggs don't die, and then you have the summers so that they replicate twice, do the math, instead of once. So you have this explosion in mosquito populations. And by the end of the century, they expect it to be endemic all over, you know, North America. Now, why this is important, the Aedes albopictus is a vector for 3 different types of encephalitis. Excuse me, I can't speak English anymore. Encephalitis, it carries West Nile, it carries dengue, and it also carries a disease that I can barely pronounce. It's called chikungunya, which is endemic in Southeast Asia and which has now become endemic in Italy because, again, you had this, outbreak in Italy, and then you had the mosquito populations that kept it thriving there. All right, bad air's harmful effects kill at least 24,000 Californians every year. And this is just in California. We're looking at across the country, it'll be similar. I don't know if any of you have been to California Central Valley, but, it is a valley, so you have to come over a mountain, sort of low mountains, but you come over, and it is. It's like driving into a blanket of bad air, and it's only going to get worse. And again, this is also affecting the poor, the disenfranchised, people of color, and it is really an environmental justice issue. Martha Cota has become an environmental activist because her son, Jose Miguel Guerrero, when he was a little boy, had terrible asthma. She'd wake up in the morning and you'd find, his lips and his fingernails turning blue. She'd rush him to the emergency room before they were finally able to, control his asthma. And, she became part of the USC Children's Health Study, which some of you may be familiar with. And it found that kids who are living, within, a half a mile of these heavily trafficked corridors, again, have much higher rates of asthma, 20% decrease in lung function, and on and on and on from all these bad effects. And these are sort of on the front lines because we're looking at the kind of air that we're going to be seeing more and more of across the country. Okay, so here's the good news. I'll try and make this quick with the good news. This is your intrepid reporter drinking sewage. So, I have to keep you around. She laughs at all my jokes. It's great. Anyway, one of the good things that I found, when I first started doing the book, as I mentioned, I was sort of in despair because, no one was talking about climate change, it seemed. And it didn't seem like, we were having any meaningful things going to happen about climate change. And, we're all going to, hell in a handbasket and sort of careening into the abyss without even thinking about it. But then when I drilled down, I found out that the public health people, the people at a local level, take climate change very, very seriously. And it's not a blue or red issue, it's a green issue. And it's talking about the health of the planet. In Orange County, California, people laugh when I say this and then they realize I'm serious, but Orange County, California, some of you may know, is a very conservative county in California. And on their promotional materials, they always have the little Republican elephant on it and, John Wayne Airport and Disneyland and things like that. But they are world leaders in water management. And I talked to the water management people there, and they said, we looked at the future and it was going to be dry. And our, sources of water, such as the Colorado River and places like that, we can see that it's going to be drying up. And, just to sort of backtrack, when the Colorado Compact was drawn up in 1922, the water allocation was based on, the previous year's runoff in the Colorado. But as it turned out, it was based on extremely wet years. And, more recent calculations within the past 5 years estimate that it's running at a deficit. In other words, we're putting a lot of money on the credit card, and it's really going to dry up. And what they've done in Orange County is, this is a toilet-to-tap program, and 20% of the water in Orange County is recycled sewage. And this is it right here. Oh, I'm sorry. I'm a technophobe here. Okay, this is it right here. This is how it starts out. This is when it gets filtered a little bit, and then this is the final stuff that I'm drinking. And what they did in Orange County, it wasn't so much the technology, but they recognized that they had to get everybody in the county over the yuck factor, to get them to understand that they weren't going to die from drinking this water. And they embarked on this public relations campaign where they were doing all kinds of talks and seminars and everything else to outreach the community and get the community on board. And since then, their program has become a template for other cities around the country and around the world, especially places like Singapore that are adopting this. And you can see they're expanding the facility. They want to do 40% is going to be reclaimed water. Okay, I don't know if any of you people know who this is. This is Pat Mulroy. Pat Mulroy is like Clint Eastwood in the water management world. And although she's actually pretty liberal, so she hates it when I call her Clint Eastwood. But what she's done is she has taken the driest city in the driest state, you know, and getting back to the Colorado Water Compact, you know, the Colorado Water Compact, you know, the water in the Colorado is divvied up based on agriculture. 1922, you know, we didn't expect these giant cities to evolve. So, you know, in Nevada, not much farming is going on. So Nevada was really sort of last in line, got very little. So she's the water manager for, you know, the county of Las Vegas. And Las Vegas has 2 million people. It's got 30 to 40 million visitors every year. How do you keep them hydrated? And Pat found a way to do it. The first thing that she did was she created a Cash for Grass program. And what that meant was that if you were willing to rip up your grass, she would give you money and, you know, plant, you know, drought-resistant plants. The second thing she did was she asked all the, you know, resorts, you know, the Wynn and Treasure Island, places like that, if they would recycle their water. And not only if they would recycle their water, if they would pay for doing it. And then the third thing is that she instituted water conservation measures. And the upshot is, you know, and I could go through a lot of this stuff, but the upshot is that the normal water usage is somewhere between 125 and 135 gallons a day per person. And in Las Vegas, it's 75, and she's trying to get it down to 50. Los Angeles, we're moving beyond coal. We want to get to no coal by 2020. Okay, the other thing that I found is that, you know, it's very nice to think that we're going to move out in the country and, you know, sort of farm by ourselves and this and that and the other thing. But the reality is that it's people who live in cities who have a much smaller carbon footprint. And this is something that we simply cannot get away from, that we have to reduce our carbon footprint. And what I found is that, you know, sustainable cities are the answer. And Vancouver, I always say that Vancouver is like the nerd in high school that used to kill the curve and all the subjects and, you know, leave everyone else in their dust. You know, Vancouver has the highest use of hydroelectric power in the world. It has the lowest rates of poverty. It has the lowest rates of teen pregnancy. It has the highest rates of biking, cycling. I mean, on, you know, just, okay, we've heard it, you know. But it's moving towards becoming not just a green city, but a very sustainable city. And, you know, I was just in Vancouver. God, was it just last week? I don't know. I've been on tour with the book, and I'm never sure where I am. And I was very struck again by what a vibrant, thriving city it is. And the reason that I bring a lot of this up for you people as public health people is that sustainable cities really are the future, and that cities that are moving towards sustainability are healthier and wealthier places to live. They're spending a lot less money on this really exorbitant energy source, fossil fuels. And the other piece is that, you know, in transit-oriented places, and I noticed this even when I was in Vancouver, you know, people walk an average of 20 minutes a day, which, as you all know, is 2/3 of our minimum daily requirement of exercise. So, you know, you look at a place like New York, the obesity rates are 12% lower than the national averages. So this is really sort of where it needs to go. This is my friend Margie Goldsmith, the great travel journalist, and she posted this on Facebook, and I said, Margie, I have to put this on my, what New York is really moving towards becoming much more sustainable. Mayor Bloomberg has instituted a lot of programs. One of the things he did was his city bike program, and it just opened up about 6 months ago. They have 10,000 bikes. They have 6,000 stations. You can just take a bike, and you can ride where you need to go and put it back at the bike thing. And there's Margie happily riding on her bike. So what we must do, oh, again, my assistant. Okay. Anyway, you as public health people are going to be on the front lines of all of this. And in addition to what's going on here in the United States, in the developing world, they're going to see this much more intensely. That's number one. The other thing is that, you know, we're able to control deaths from heat waves because we've gotten smarter about it. We open up cooling centers. You know, we dispatch buddies to make sure that the elderly and shut-ins, you know, get some kind of air and water. and we have air conditioning. But, you know, I remember I interviewed this atmospheric physicist, Steve Sherwood, when I was doing the book, and I said to him, well, can't we all just get air conditioning? And he's one of those people who just does not suffer fools gladly. And I thought he was going to throttle me when I said that. He said, do you think people in developing countries can afford air conditioning? Do you really think that and as energy prices go up, they're going to afford it? And unfortunately, in developing countries, we're going to start seeing die-offs in the tens of thousands, maybe even more, you know, when we have these heat waves. So that's one aspect of it. The other aspect that we see in the developing world is increasing rates of violence and civil unrest related to climate change. I'm sure you saw that study that was in Science. It was a meta-analysis a couple months ago that was done by UC Berkeley researchers that showed that, you know, it predicted that, you know, by 2050 we're going to see a 56% increase in civil unrest. And, you know, there was criticism to the methodology and this and that and the other thing. But so much of this stuff, if you just think about it, it's just basic common sense. I mean, if you have a drought-driven collapse of farming and people are hungry, they get cranky. You know, we saw this in 2008, we saw this in 2010. You know, when you had crop failures in Africa and Asia, in the Soviet Union, when you had that, you know, heat wave, it reduced the wheat by 40%, and the Kremlin banned exports of wheat. You had riots across Africa and in Egypt, which were heavily reliant on Russian wheat. So these are the kinds of things that we're going to be seeing in the future. So I always exhort people, I think we can fix this, and the adaptation strategies we need to adopt can create a better, healthier, happier world. Oh, there we go again, but we must start now. Anyway, I'll leave you with the words of Carl Sagan, and you know, as public health people, you really are on the front lines of this. You're going to be dealing with this. You're going to be dealing with the extremes, weather events in the communities that you choose to work in. You're going to be dealing with, you know, the migration of, you know, diseases to newly warm habitats, diseases that we've never seen before in this country, diseases that we have no treatments for, that we have no vaccines for, and on and on and on and on. Anyway, I can't think of anything else, but I'm sure you'll have questions, and I really thank you for your time. Thank you. Does anybody have questions? They asked me to stop at quarter. Yes, go ahead.
How do you think sustainable cities will help the development?
Okay, well, that's a really good question because, you know, I really did talk, you know, my book really focuses on North America, and I also spent a lot of time in Australia because, as many of you might know, Australia is on the front lines of climate change, and I really wanted to look at what climate change looked like in a industrialized, developed democracy, you know, because it's very easy to dismiss what's going on in Bangladesh and what's going on in Kenya. Well, they don't have the infrastructure and this and that and the other thing. But developing countries are very keenly aware of what's going on. And I was very heartened. There's a report that came out earlier this year, and it looked at what 200 cities across the world, and it included a lot of cities in Africa and Asia, are doing to make their cities more sustainable. Obviously, they're having to play catch up, you know, so they're not, you know, don't have the kind of infrastructure that we have, but they're really trying to reduce their carbon footprint. They're really trying to reduce, you know, the reliance on fossil fuels, and they're trying to improve water management techniques. I mean, especially in places like Singapore, you know, that recognizes that, you know, they import all their water from Malaysia, and, you know, they can't really expect to have an unlimited supply of water. You know, Bangladesh is very keenly aware of the fact that they're going to be flooded underground, you know, flooded underwater shortly. So this is a very good question. It's not just happening in the developed world. In the developing world, you know, there's a lot of really wonderful sustainable programs that are going on, looking at better farming techniques so that, you know, they can move towards, you know, developing agriculture in either a wetter or drier climate, whatever it is in that. So I don't know if that answered your question, but yeah. Well, I don't have them off the top of my head, but if you email me, I will send them to you. There was a really excellent climate report that came out earlier this year that really details in great detail a lot of the programs that are going on around the world in African countries and Asian countries, as well as, you know, Amsterdam, you know, the United States, but Jakarta, places like that. Anyway, I'm sorry. Go ahead. Go ahead. You know what? Could you talk louder?
So when you started out, you mentioned that
Well, the frustrations that you're voicing at every single talk I've given, somebody has asked this question, and I don't mean to sort of try and move around it, but I think there's a couple things. Number one, I think we've reached a inflection point in our understanding that climate change is happening and that climate change, that we did it ourselves. I know the studies say that 40% of people don't believe in climate change, but you know what? I don't believe that. I'm a journalist. I'm not a scientist. I am out there. I talk to people all the time. I mean, seriously, I was just in Virginia. I did a couple lectures in D.C., and I was visiting my friend, and we were sitting there with the guy who's redoing her kitchen. He's just this basic working class kind of guy. And he says, I can see the climate's changing. So I think that there is that awareness that's going on. Billy Shanks, who's the fire department captain. Billy Shanks, I always say this, his politics are to the right of Attila the Hun. They really are. But I am going to keep you around. I mean, they really are. And I said to him, Billy, this book is about climate change. I don't want it to come out and you to feel exploited, because I just don't operate that way. I'd like your voice in the book, but I can find somebody else. And he said, I'm a firefighter. You don't have to tell me about climate change. So I think that we've reached a flexion point on the recognition. Now, the other piece of it is the behavioral change. That's a huge piece, because we're asking people to make huge behavioral changes. And on that one, I really can't answer that question. Thomas Friedman, again, he said that we need to make the hard choices, otherwise nature will make them for us. And I think, unfortunately, that is what's going to happen. You sort of look at the arc of what happened with smoking. And in the 1930s, doctors were starting to see the link, between too much smoking and people getting cancers and lung diseases. But it wasn't until 1964 that the Surgeon General issued that report. We had warning labels on cigarettes. And, I moved out to California in the 1970s, and, I would always joke with my friends in New York that, well, in California, we confiscate your cigarettes at the airport, that and stuff. And I said, hell will freeze over before they, ban cigarettes in, New York bars and places like that. Well, hell has frozen over. But, the problem is that this was, a 70 or 80-year process, and we don't have 70 or 80 years. So I think the answer to your question is that, unfortunately, nature is going to force us to do it. And I think that is what's going to happen. And that, sort of feeds into some larger questions of why are we rebuilding the Jersey Shore? Remind me again why we're rebuilding that. Remind me again why we just spent $200 billion to rebuild New Orleans. I know this is very unpopular, but the evidence is that New Orleans is going to be underwater in 2050, no matter what we do. So these are all, questions that we have to ask. I know I didn't answer your question, but I'm not sure there is an answer. Anyway, go ahead.
Can I ask another question along those lines? You mentioned early on the gap between where scientists' minds are and the health perspective. I mean, the science in terms of climate change and health is messy, and it's not a simple soundbite. And so what can we help communicate, what we know?
Well, I think that there are examples where it's really obvious that climate change is causing certain things. Obviously the heat waves. I mentioned earlier, I told you, sunbathing in Siberia. That's the title of my next book. I mean, really, I saw these people sunbathing in Siberia. The other piece of it is that we're starting to get these very strange tropical disease outbreaks in British Columbia. So there are things that we can focus upon that are proven. And you're right. I mean, it gets very messy. And, the reason I talk about the 80s albopictus is because that's very clear. It started in Houston. It's now in Connecticut. Hello? I mean, you can't, it's migrating to newly warm habitats. But, you really can get it. And that's why I've tried to pick some, simple examples, because it's very easy to get into the weeds, with all the qualifying, because you are scientists. And you want to be very clear about this. And you'll notice I haven't talked about tornadoes, because I was very careful about that. You know, from a common sense point of view, yeah, I mean, you know, it's sort of heating up and you're getting more energy in the atmosphere. You're probably going to get more tornadoes, but there's no scientific work done there. So I don't really talk about tornadoes, even though to me, you know, it seems common sense. So I think if what you could do is sort of focus on what we know, you know, is that, you know, in extreme weather events, we do see the collapse of the public health system. How can we repair that? You know, that's one. The second thing is that we do see mosquitoes migrating to newly warm habitats. We do have dengue now in the United States, so we could focus on that. The CDC, by the way, is all over this. I mean, they've really, really been, you know, very much in front on this. They've been setting up, beefing up their surveillance networks so that they can, you know, identify outbreaks because, you know, that was one of the problems with West Nile. They had no idea what they were dealing with, no idea. And I talk about that a lot in the book. And if they had known sooner what they were dealing with, they, you know, could have taken steps to stem the outbreak. I don't know if I answered your question, but I think that what we have to do is there's enough science now and enough just basic common sense that, you know, we can point to in working on this. Anyway, go ahead.
Great talk.
Oh, well, thank you.
Combination between science and common sense.
Oh, yeah.
I'm wondering, you were talking about migration, and has there been any all moving to Vancouver, or what's gonna happen, and how will that impact health?
Okay. I can't, you know, some of people's names I can't pronounce, but there's a climatologist, and I think he's right here at NCAR, Agui Duo. I can't pronounce it, but if you email me, I'll give you the study. But he talks about how if emissions continue the way they're going, we're looking at this huge belt, you know, that's going to be completely dry, you know, in the equator and places like that. And, you know, where are people going to go? And there have been sort of scattered studies, you know, and a lot of this is done by the Defense Department, you know, because they see climate change as a gigantic security threat, and they're looking at that because, you know, part of the problem is that, you know, in developing countries, they don't have the infrastructure. So when we have this drought-driven collapse of agriculture, you're going to start seeing millions of people starting to migrate. And just FYI, you know, when I was in Australia, they're starting to build detention centers in the northern part of the country. They're really expecting, you know, spillover, you know, from the Philippines and from Indonesia. And they're starting to, you know, they're starting to plan on all this. So there are studies that are looking at the kind of migration that's going to happen. You know, there was a really horrific book, but unfortunately it's based on a lot of good science called Tropic of Chaos. I don't know if you heard of it, by Chris Parenti. And it talks a lot about, you know, if we don't start, you know, clamping down on emissions and doing adaptation strategies, it's going to be the end of civilization as we know it. You know, we're going to be looking at militarism. We're going to be looking at closed borders. It's really not a pretty picture. It's hard to imagine, but we really can have things like runaway climate change where the climate can really start, you know, this whole thing can really accelerate. And, you know, the thing I always talk about, you know, Donald Rumsfeld with the unknown unknowns and then the known unknowns. And the known unknown is methane. You know, that's the big wild card. That's the thing that keeps, you know, climate scientists up at night. And as the permafrost melts, it starts releasing all this methane. And they always say that methane is 20 to 70% more toxic as a greenhouse gas than CO2. Well, it's actually 70%. You know, the 20% is when it's dissipated quite a bit. And if there is this huge release of methane, you know, all bets are off. I mean, who knows what's going to happen to the climate system? So I don't know if that's helpful, but I would check out Chris Parenti's book. So he has a lot of information in there.
We're going to have to end it because there might be a class.
Okay.
I'm not sure, but thank you all for coming.
Yes, thank you. And please email me about those studies. I really meant it. I have those.
And our colleagues in the bookstore is here, so if you're interested in purchasing the book.
And I'll be happy to sign them for you and answer any questions you might have. Anyway, thank you so much for coming. It was a pleasure. Thank you.